Vitamin B12 is part of the vitamin B complex, sometimes referred to as a pain-killing vitamin. It helps DNA production, cardiovascular support, and energy metabolism. Vitamin B12 is a very important marker to monitor, especially if you haven't been leading the best lifestyle, or if you have a known chronic health issue. However, a blood test for B12 can fail to detect a deficiency, as folate fortification of food can throw off the test and give a false reading. B12 is also referred to as cobalamin. It's a water-soluble vitamin. It contributes to the successful synthesis of DNA, the normal functioning of the nervous system, and the production of energy. The liver is the main site of storage of the B12 in the human body. Humans can obtain the B12 from dietary sources, fortified foods, and supplements. It can take the form of cyanohydroxy metal and deoxyadenosocobalamin. Cyanocobalamin, the most stable and unnatural form of the B12, is most commonly used in supplements, and it doesn't have a direct cofactor role in cellular metabolism. I would advise against this and recommend methylcobalamin instead. The most biologically significant form of the B12 is methylcobalamin and coenzyme B12. Vitamin B12 was considered the pain-killing vitamin in some countries as far back as the 50s. Intramuscular B12 at 1 mg daily for 10 days, plus lifetime monthly injections, is an effective treatment for congenital vitamin B12 malabsorption. Oral and intramuscular B12 supplementation can prevent and treat a B12 deficiency of different origins. High oral doses of up to 1,000 micrograms daily can be equally effective as intramuscular treatment, even in cases of pernicious anemia or malabsorption disorders. However, more severe cases with symptoms of nerve damage may require prompt intramuscular treatment. Hydroxycobalamin intravenously is likely effective for cyanide poisoning due to inhalation, ingestion, or skin exposure. This treatment has been approved by the FDA, including cyanide toxicity treatment in pregnancy. B12 deficiency causes excess homocysteine. This is a proven risk factor for cardiovascular disease. Supplementation with B12 alone or in combination with folate and B6 can successfully reduce the homocysteine levels. Check out my video on the MTHFR gene polymorphism for information about how this can be diagnosed and treated naturally, as an MTHFR polymorphism can affect your homocysteine levels. According to clinical research, methylcobalamin treatment reduces pain symptoms in neuralgia, diabetic neuropathy, and lower back pain. Injected methylcobalamin, a form of B12, reduces the clinical symptoms in legs such as paresthesia or an abnormal sensation like tingling or prickling, burning pains and spontaneous pain in some patients with diabetic neuropathy. A meta-analysis of 7 clinical trials confirmed its moderate benefits for some symptoms of diabetic neuropathy, including pain. In one study, methylcobalamin significantly improved symptoms such as pain and prickling sensation in patients with neck pain. It appears to be safe and effective for nerve pain due to the herpes simplex infection, according to 2 clinical trials on 178 patients. Methylcobalamin improved different types of neuropathic pain in animal models. It increased the regeneration of axons and promoted neuronal repair. You could check out my video on diabetic neuropathy for other natural treatment methods. Higher homocysteine and decreased B12 levels have been associated with an increased risk of age-related macular degeneration. One study involved 5,442 older women who had been taking B6, B9, and B12 for 7 years. The study found a 34 to 41% decrease in the risk of the macular degeneration when supplementing with the B6, B9, and the B12. In a randomized trial performed on 200 patients with depression and low normal cobalamin levels, cobalamin supplementation improved depressive symptoms when added to the standard treatment. A review of 11 studies found that prolonged supplementation with folate and B12 for several weeks to years may decrease the risk of depression relapse in the long run. Short-term effects were insignificant. You could check out my series of videos on neurotransmitters and my videos on mental health conditions for more natural treatment options. Topical cobalamin improved the symptoms of atopic dermatitis, such as skin rash, redness, and itching, in 2 clinical trials of 70 patients. It was effective and well tolerated in both adults and children. Cobalamin may have a role in the prevention of disorders of brain development and mood disorders, as well as Alzheimer's and vascular dementia in the elderly. A meta-analysis of 68 trials found that Alzheimer's disease patients have significantly lower B12 levels. Additionally, they identified elevated homocysteine as a risk factor for the Alzheimer's. According to one study, taking B12, B6, and folic acid for 2 years may slow down the brain atrophy in the areas associated with cognitive decline and Alzheimer's disease in some patients. I also have a video on the natural treatment of Alzheimer's disease if you're interested in learning more. In a trial of 126 patients, the majority of cases with a primary circadian rhythm sleep disorder responded well to B12 supplementation and bright light therapy. However, patients with a secondary circadian rhythm sleep disorder due to another health condition did not respond well. The response was variable in another study on 106 patients with different types of sleep disorders, but most groups experienced mild to moderate improvements. B12 is found in many foods, such as liver, clams, sardines, steak, tuna, trout, salmon, eggs, milk, shellfish, nori, and mushrooms. When it comes to nutritional yeast, only fortified products contain the B12. Despite some misleading claims of supplement manufacturers, yeasts do not naturally contain the form of B12 that our bodies can use. The long-term consequences of less severe B12 deficiency are not fully known, but they may include adverse effects on the nerves, the heart health, mental health, and cognition, and more. B12 deficiency may be associated with infertility and miscarriage in some women. B12 deficiency causes excess homocysteine, which is a proven risk factor for cardiovascular disease. Individuals with a B12 deficiency have a higher prevalence of cardiovascular risk factors such as heart failure, stroke, and diabetes. B12 plays an essential role in the production of red blood cells, and low red blood cells can indicate a B12 deficiency. Weakness and fatigue can result if your red blood cells are low, since you're not getting enough oxygen to the tissues. A blood disorder that results from a B12 deficiency, malabsorption, is called pernicious anemia. Low levels of B12 have been linked to depression, Alzheimer's, and other types of cognitive and mental impairment. Multiple studies show that a B12 deficiency in the elderly can increase the risk of weakness, frailty, and disability, and it can increase hospital stay. With regards to bone health, some studies show that a B12 deficiency is associated with lower bone mass. Although rarely, the B12 deficiency can cause blurred vision or eye pain. This can occur when an untreated B12 deficiency results in damage to the optic nerve. Vitamin B12 deficiency increases with age, from about 1 in 20 among people aged 65 to 74, to 1 in 10 or greater in people aged 75 or older. Other people at risk of a B12 deficiency include people on a vegan or vegetarian diet, people with anemia, people with gastrointestinal disorders like Crohn's or celiac disease, those who have had gastrointestinal surgeries. Pregnant women require higher levels of B12 to prevent birth defects. Infants born to a B12 deficient mother or receiving deficient amounts of animal-sourced foods are susceptible to a deficiency between the ages of 6 to 12 months. Some patients with type 2 diabetes who are prescribed metformin may be at risk for cobalamin deficiency. Proton pump inhibitors or histamine 2 receptor blockers can lead to a B12 deficiency and result in poor absorption. Hormonal birth control use among some female subjects also reduce B12 levels. For more information about vitamins, herbs, supplements, or natural treatments, check out my website.